The Wellness Revolution starts now.
Hello, I'm Dr. Steve Hotze. Welcome to today's program. We're going to discuss a commonly diagnosed problem in children and sometimes in adults known as ADD or ADHD. That's attention deficit disorder or attention hyperactivity deficit disorder. This has become a kind of catch-all for kids in school that don't do well. They're unable to concentrate, focus clearly. Maybe they're hyperactive in the class. They don't do well in their school. They can't manage their time well. And it's also adults that have very similar problems. They just don't seem to be able to focus. They aren't able to concentrate, and they don't do real well in life. They're not able to keep a job, and they kind of bounce from things to things. They're never able to really focus their attention on what needs to get done. And both the kids and these adults are sent to doctors who give them, conventional doctors who give them amphetamines. They give them Ritalin, they give them Concerta, they give them Adderall. These drugs are highly addictive drugs. They're amphetamines. Just like you think about these people that take amphetamines, methamphetamines, and the problems they cause. These drugs cause very similar problems. And the reason a person is hyperactive or is unable to focus or concentrate or have good memory or good recall, there's got to be something going on internally within that individual causing that problem. And it's oftentimes hormonal. It can be caused by a low thyroid function. A person that's low thyroid is going to be fatigued. In kids, when they get that way, the fatigue is making them tired, so they become hyperactive as a response to the fatigue to keep them from falling asleep or becoming extremely tired. So they try to stay active. It's a mechanism that the body uses when it doesn't have the overall energy. It compensates in a way by becoming hyperactive to overcome the fatigue that the individual has. And the same thing can happen in adults. And this can be caused by hypothyroidism. Low thyroid can be a very common cause of attention deficit and attention hyperactivity disorder. So when we see individuals, particularly kids, that's one of the things we think about. And in adults too, we think about low thyroid function. It's a commonly unsuspected illness that many people have, and it's due to really the effect of I believe it's due to the effect of the environmental toxins on our system and on our thyroid gland. We got fluoride in the water, for instance, and fluoride adversely affects the cell's ability to convert the active thyroid hormone, the inactive thyroid hormone T4, which has 4 iodine molecules, into the active hormone T3. When you have fluoride, it poisons the enzyme within the cells that make that conversion, and the cells cannot produce enough energy if they don't have enough active thyroid hormone T3. So there are a number of reasons that people may have poor thyroid function. I think a lot of it is environmental. The other thing that can cause problems with attention deficit disorder could be chronic adrenal fatigue. And the adrenal gland produces adrenaline, of course. That's a fight or flight hormone. Somebody pulls a gun on you, you want to run away or fight, or they pull a knife on you, you're going to run away or fight. So it's fight or flight. The other that's a short-term hormone. The long-term hormone for chronic stress, the stress of, having to drive the freeways in Houston, to pay for increased inflation prices, making enough money to make ends meet, worrying about maybe a loss of a loved one or a relationship that's gone south. All these cause chronic stress and pain. Allergies all cause chronic stress on the adrenal glands, which produce cortisol. And as the adrenal glands become fatigued, they don't produce as much cortisol, and that can lead to the symptoms of anxiety attacks, of course, the severe fatigue. That's why we call it adrenal fatigue. It can also lead to hair loss, muscle and joint pain, low blood pressure, standing up quickly, and all of a sudden you feel like you become dizzy, maybe even feel like you're going to pass out. That's hypotension. Low blood pressure caused by a quick rise. It can cause heart palpitations, recurrent infections. All these can be caused by adrenal fatigue, depression as well, and headaches. So that's one other cause of ADD is the adrenal fatigue that occurs. Another cause of adrenal fatigue can be allergies. Chronic allergies do lead to adrenal fatigue. Chronic allergies can cause the body to, when you have chronic sinus infections and chronic headaches and chronic cough and congestion and earaches and all these things, allergies can wear you down. And it really is the effect that the allergies are having on the adrenal gland, which is trying to pump out cortisol to relieve the inflammation. Two other things can cause attention deficit: a poor diet, a diet high in sugar. We say, don't give the kids sugar, honey. They're going crazy. Well, sugar causes sugar highs and sugar lows, and it causes kids to bounce off the wall. So if you have a diet for your family, an eating plan that's high in carbohydrates, that quickly convert to sugar, and that can cause your kids to be hyperactive. And another thing that can also cause hyperactivity is really lack of exercise, and that's important for you to be able to stay focused. So exercise is a key ingredient to good health. But the major problems that cause the hyperactivity and the attention deficit disorder are low thyroid. Secondly, would be low hormonal production in your adrenal glands, adrenal fatigue, followed by allergies and poor eating program. All these contribute to ADD. You don't need to take amphetamines. Amphetamines are a gateway to a whole bunch of other drugs, including cocaine. I mean, people get addicted to these drugs and to the highs that they get with them. So I would not recommend putting anybody on Adderall or Ritalin or Concerta or any one of these amphetamines. Just is not the right thing to do. You can handle this problem naturally, and that's what I encourage you to do. If you'd like to know more about what we do here at the Hotze Health and Wellness Center, don't hesitate to give us a call. By the way, I want to mention, too, when I talk about foods, I should say food allergies can also cause attention deficit disorder and hyperactivity. We've seen that. So it's the common foods: wheat, corn, egg, milk, yeast, and soybean. They're in all the packaged foods. So people can be allergic to those, and those can cause an individual to have attention deficit disorder. Those foods can cause the release of histamine in the body, and that's vasoactive, and it affects the brain, and it can cause attention deficit disorder. And not only can foods, allergies to foods cause attention deficit disorders and hyperactivity, but the dyes that are in the foods and in the drinks, there are red dyes and yellow dyes and green dyes and all kinds of dyes, which are chemical products which adversely affect the brain. Another thing is monosodium glutamate, and that's another one that has an adverse effect on the brain cells and the brain function, and those are added to the food. So all these packaged foods, canned food, bagged food, all this has all kinds of chemicals in it, and you may be allergic, or your child may be allergic to not only the ingredients, the wheat, corn, egg, milk, yeast, and soybean, but could be allergic and react to the chemicals in the food and to the dyes in the food. So be very careful about that. So you want to clean up your kids' eating program and your eating program if you want to have good brain health and mental function and not be afflicted with attention deficit disorders. So give us a call. Ask for this book, Hormones, Health, and Happiness. Our phone number is 281-698-8698. Don't hesitate to give us a call. We'll be glad to give you a copy of this book complimentary, and we'll ship it to you for free. I want you to understand how your body works and what you can do naturally to maintain health so you have energy, vitality, and enthusiasm as you live. Thanks so much for joining us. I'm Dr. Steve Hotze.
At Physicians Preference Pharmacy, we understand that the quality of your compounded medications directly affects the way you feel, which is why we believe that your pharmacy should specialize in compounding medications while also delivering extraordinary hospitality and guest service. we believe that both patients and prescribers should accept nothing less than consistency and quality from their compounding pharmacy. This is why we've implemented some of the strictest quality standards in compounding, exceeding standard requirements, achieving PCAB accreditation, which is the Pharmacy Compounding Accreditation Board, an organization that sets the highest standards in compounding pharmacy regarding the safety, cleanliness, and quality of your compounded prescriptions. Because of our commitment to complete health and wellness, we are dedicated to making your medications free of lactose, parabens, artificial sweeteners, and any unnecessary dyes, binders, or fillers present in many other medications, offering you the cleanest products possible.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.